Hello, my name is Mark Sherman. I'd like to spend a few minutes talking to you about hernias. Now, I think many people have heard a lot of different things through the years about hernias and what kind of repairs there can be and do they need to have it fixed. So I thought I'd go through a few things with you to give you a little bit of the background and different ways of fixing a hernia. Today I'm going to focus primarily on hernias in the groin called an inguinal hernia. Inguinal hernias have been around probably since the dawn of man, and there have been many different ways of trying to fix hernias through the years. A hernia is an opening in the muscles of the abdominal wall. So if we look at the muscles on somebody's abdomen, we can actually see an area where there can be a hole and tissue inside can push out through that opening. Hernias can occur when somebody has an incision and that incision was healed but then opens up with time. But hernias can also occur down in the groin. And they're a little bit more common in men because there's a natural opening in the groin. That's where the blood vessels that go through the abdominal wall to go down to the testicles and come back up go through an opening in the muscles. If that opening stretches and dilates, other tissue can go out alongside those blood vessels, and that's what creates a hernia. Is there really a reason to fix a hernia? With a small hernia, there's very small risks to any bad things happening. The biggest issue is the fact that that hernia is almost undoubtedly going to get larger as time goes on. So for somebody who may be very elderly and has a very small hernia that's found, it's a very reasonable thing just to watch that. But for the majority of people who are active in their daily life and have years ahead where that hernia can get larger, I think repairing the hernia is the appropriate and the right thing to do because there are problems that can arise. It turns out that pain is not usually a typical thing with hernias, although sometimes they can be uncomfortable. But as hernias get larger, the tissue inside starts to push through, and that tissue may just be a little bit of the fatty tissue underneath the surface, but as time goes on, you can have intestine that pushes through, and that intestine can get blocked, it can get kinked, and in severe cases, the blood flow to the intestine can be compromised, fitting through that small opening, and then you can have an emergency procedure. Emergencies with hernias are rare, but what's not rare is the fact that they almost always progressively get larger and do get uncomfortable as more and more tissue pushes out, and therefore we recommend fixing it when it's smaller, it's easier to fix, and the chance of it coming back when it's smaller is much less. So how are hernias fixed? Well, many years ago, hernias were repaired by making an incision, opening up the top layer of the skin, opening up the top layer of the muscle to see the opening in the muscle, and putting stitches in and bringing it together. And I got to tell you, that hurts. It could be uncomfortable for a while, and it was only as strong as the muscle tissue that was present. And so that muscle tissue could slowly stretch and pull out around the stitches, and hernias would come back, called a recurrent hernia. In the 1970s, and quickly gaining popularity in the early 80s, was a technique with using mesh. And mesh is a little bit, picture kind of like the screen on a window, but made out of a different material. And that screen can lay in the area, and your body incorporates, the tissue in your body incorporates that screen, and it essentially creates a layer of strong, secure tissue that can't stretch, can't open, and prevents the hernia from pressing out again. By using mesh, the hernia recurrence rates went significantly down, and not only that, it wasn't as painful because we don't have to pull the tissue together as tightly. Now, these techniques have evolved with time. The technique that I use and have used for many years in this office is called a laparoscopic inguinal hernia repair. The advantage to a laparoscopic repair is actually in a number of different areas. A laparoscopic repair means that rather than making an incision through the skin on the surface over the hernia and opening up the top layer of the muscle and then putting mesh down and closing everything up, I make a little incision right near the belly button. I put a video camera in just behind the muscle. There's different layers. We don't go in where the intestines and things are. I'm actually right behind the muscle. And then with two other small incisions, and by small I mean 1/4 inch incisions from my instruments, I can actually see on the back side of the muscle. And with that, I can see where there's an opening in the muscle and tissue is pushing out through that opening. And with my instruments, I pull that tissue back in and I lay the mesh on the inner side of the muscle. The advantage to doing that is a little bit like patching the tire on a car that might have an opening. When the patch is on the inside, the pressure in the body presses against the mesh and holds it against the muscle, instead of the older technique where the mesh is on the outside of the muscle and anything pushing through could lift the mesh off. But there's a few other reasons why a laparoscopic approach is my preferred approach. When somebody has a hernia on one side that's big enough to see, we can actually see internally whether there's any weakness on the other side, and I don't need to make any additional incisions. I make the camera look at that side, move my instruments to that side, and with the same 3 small incisions, I can see if there's an early hernia developing on the other side and repair that. And in terms of the recovery and discomfort and things after the procedure, almost the same. And so the advantage for people is that they don't come back to me in a few years saying, hey, Dr. Sherman, great job on this side, we got another side to do. We can take care of both sides at the same time when it's indicated. I don't put in mesh as a preventative measure because we don't want to do anything that might potentially cause problems, but if there's any signs of weakness, we can take care of everything all at once. There's a few other reasons why I like doing laparoscopic inguinal hernia repairs. One of the ideas is that I don't need to cut any of the muscle. Unlike the older techniques where we'd have to open up the skin and the muscle to get to the area of concern, laparoscopically, when I put in my video camera near the belly button, I just slide the muscle fibers to the side and the camera goes in. When we're done, the camera comes out, the muscle fibers slide back over. Where the instruments go in, the muscle fibers are running up and down, the instruments go between the muscle fibers, and when I take them out, the fibers close back up. So there's less discomfort afterwards. I don't want to say that it's a pain-free operation. There is some discomfort and swelling, but certainly less than the other types of procedures, and that discomfort goes away much quicker. And finally, I think it is actually a stronger repair. By having that patch on the internal aspect of the muscle, the repair is so strong that for my patients, there are no weightlifting restrictions afterwards. I have not had a patient who's made their hernia recur by lifting something too heavy or playing sports too soon. From my standpoint, when you feel comfortable doing activities, you can do whatever activities you desire. I've had some patients who pushed things and went back to the gym within days of their operation. Admittedly, probably not the smartest thing because they were pretty sore, but for them, going to the gym was more important, and it does not affect the hernia repair. So from the standpoint of when you can get back to work, when you can get back to exercise, my answer to you will always be, as soon as you feel comfortable, do whatever you'd like. One of the issues that can be of a benefit with the laparoscopic repair is if you've had a previous open hernia repair, when I perform a recurrent repair, in other words, the repair that you've had previously, over time it gave out or opened up again, when I do my repair laparoscopically for you, I'm not going through an area where there's previous scar tissue, so the risk of being affected or compromised in the repair is significantly decreased, and the risk of injury to any blood vessels and nerves is also decreased. And in fact, one of the concerns, and it's been a more prevalent concern sometimes in reports these days, is the incidence of chronic pain after an inguinal hernia repair. That pain is usually based on the fact that there's a nerve that goes through that area fairly close to where those blood vessels that go through the abdominal wall down to the testicles. There's a blood vessel called the ilioinguinal nerve, and it provides some of the sensation in the area down by the groin. That nerve can be affected by a repair, and in fact, in my opinion, the open repair, there may be a slightly higher risk of injury to that nerve. When I've performed this repair laparoscopically, the incidence of having long-term discomfort from that nerve is almost zero. That's much better than what is reported in the literature, and I think part of that is because of the experience I have doing this repair and understanding the anatomy. In over 2,000 inguinal hernia repairs, I think we've come up with a very good way of providing you with an excellent operative procedure with the quickest recovery.